you for your nurse today. Can you please give me your name and date of birth?
Summer Jones, 12/18/02.
All right. I noticed in your chart that you were coming in for a wellness exam today. Is this correct?
Yes.
All right. I also noticed that a tech came by to take your temperature, your pulse, your respirations, your blood pressure, and pain. All right, and your oxygen saturation as well. All right. So what I'm going to be doing today is I'm going to be looking at your body systems, just like it says, from your head to your toe. And if you have any areas of concern, just let me know. Now, do you have anything you would like to share to me that you're kind of concerned about today? All right, any pain anywhere?
No.
I'm also going to be taking a good look at your skin throughout your systems and just looking for anything abnormal. So if you have any concerns with that as well, just let me know. All right. Do you need to use the restroom?
No.
I also noticed that when you came in and you were walking that you had good gait and posture. Now, do you use any assistive devices?
No.
Okay, well, we're going to get started. I'm going to lift the bed, okay? Alright, so I'm going to start with your eyes and your mucous membranes, okay? So I'm going to shine a really bright light in your eye, okay? So it's really bright. So I need you to look over my shoulder. Alright. Alright. And if you'll stare at the tip of the pen for me and follow it with just your eyes, okay? Alright. Just follow it. Alright, and if you'll look up for me. Alright, and if you'll say stick your tongue out for me a little bit more. Good, okay. So your mucous membranes look pink and moist. They look very nice. So now I'm going to palpate your lymph nodes. Alright, and if you have any tenderness or anything, you just let me know.
That was good. Outside at your mobility walking care, that was fine. Any concerns about it? Okay. Are you in any pain? Can you rate your pain at 0 out of 10? Do your work.
Can you swallow for me?
Good. Ask about your bowel movement and urination. Any concerns about that? Constipation? The urine good? Okay. All right. Do we use first?
Alright, I'm going to take your skin sugar real quick, okay? Alright, and it comes back. Perfect. Alright. Now I'm going to look at your, now that I noticed that, I noticed there was no lesions, moles, scars, or edema, and that her skin is in coordination with her ethnicity. Alright, so now I'm going to take a look at your anterior chest. So, take a deep breath for me. Alright, and I noticed that her breathing is unlabored with evenly distributed and no use of accessory muscles. And I also noticed no lifts, pulls, or heaves when I saw her in any of her cardiac regions. Okay? Alright. So now I'm going to listen, okay, to your heart sounds. Now for this, I'm just going to need you to just sit there, but when it comes to the lung sounds and listen to your breathing, I'm going to need you to take a deep breath every time I move the stethoscope, okay?
Can you look up to the ceiling? Look inside your nose. That's looking good. Okay, can you open your mouth for me and hold your tongue out?
Okay.
Alright, that's looking good. And I'm gonna hold a pen out, and can you follow the pen on your eyes and not try not to move your head with it? Okay. Good.
You mind lifting that for me?
Alright, now I'm gonna check for your lymph nodes to see if anything is swollen. Swollen.
Okay.
Alright. Okay, I'm gonna go ahead and check your skin and your edema.
Alright.
Your moisture's good, temperature good, that's warm.
Good. Now I'm going to do that again
Get your skin just
with
a
my
little
bell,
bit.
okay?
Alright, that's good. I'm gonna check this violet for your trachea. That's good. Can you swallow for me? Good, good. Okay. Alright. Now we're going to move on to your anterior chest wall. So I'm just looking, I'm gonna inspect first and then inspecting the muscles, the temperature, the skin looking good. I'm gonna push up just a little bit. Okay, the breath's good. Alright, that's good. Can you breathe in out for me? Okay, that's good. Alright.
Alright.
Now I'm gonna go
And I
ahead
noticed that your
hold,
S1 and S2 sound normal.
Listen to it first with the
Alright.
the diaphragm. And I'm gonna listen to the aorta, the pulmonic, or tricuspid, mitral, and the gastric.
So So now I'm going to do your anterior lung sounds. So this is the part where I want you to say, or for you to take a deep breath in and to exhale, okay? Each time I move it. All right?
Okay, I'm on it.
Okay.
Kind of
Breath in.
Tricuspid. Now the mitral. Okay, now we're looking for the gastric. Alright, now we're looking for the bell. Gastric. Okay, and mitral. Tricuspid.
Can you lift up for me?
Spinal nerve. Pulmonic.
Deep breath.
And the aorta.
All right.
Alright, that's good. Now I want to listen to the breath sounds. When I put the stethoscope on your chest, just breathe in and out for me, okay?
Deep breath. Okay. Good. All right. Now I'm going to do your posterior sounds. But what I do need to look at first is some things. If you'll turn for me. Okay. All right. So I'm going to feel your spine. I'm going to feel your spine, and I notice that it's no signs of scoliosis or anything. It's very nice and straight. All right. Now I'm going to ask you to breathe again for me. All right, nice, okay. Feel. Now if you'll do your arms back kind of like a, there you go, perfect.
Alright. Now
Beautiful.
I listen to the
All right, and if you want to, you can sit with your arms crossed while I listen to your posterior lung sounds. And you're gonna do the same thing. Take a deep breath in and exhale.
the spine is placement. So the spine looks good, the scapula looking good. I'm gonna spread that against the middle. Looking good. And the spine placement. Alright, so now what I'm gonna do, I'm gonna listen to your breathing sounds for the posterior of the back. Just breathe in and out when I put the stethoscope on your back.
All right. So now I need you to lay down for me. You'll also notice there was unlabored breathing again. Okay. All right. Now listen. Now, do you have any pain or problems when you use the restroom?
No.
Okay. Just gonna take a listen.
Alright, breathing sound, you turn that my way. Alright, so while you're sitting up, I'm going ahead and set the arm, your limb, okay? So I'm gonna check your temperature, that's warm, good, good, about 1
Alright.
with some warm heart.
Now I'm going to palpate,
Push
okay?
away from it.
And if you feel any tenderness or anything, you just let me know.
Alright, okay, I'm gonna check your pulse. And then,
Anything? All right, so I noticed that her abdomen was symmetrical, no distension noticed, and her bowel sounds were all present, okay? And you can lift up for me. Alright, so I'm going to feel the temperature and comparedness of your arms. Okay. Alright, so as expected, it's warm at the top. Your fingers are a little bit colder, but that's normal. I'll take your capillary refill. Alright, your radial pulse. Alright. Now I'm going to feel a place on your body and you let me know what I'm touching, okay?
Right upper arm, left lower arm, right lower arm, left upper arm, right thumb.
Alright. Now I need you to grab my hands, my fingers. I need you to pull me to you and then push me. Alright, so you've got good grip strength. Alright, so now I'm going to need you to lay down for me. No, there's a lot of back and forth. Alright, so I'm going to do the same thing. Alright, so I'm going to feel your warmth again. Alrighty. Alright, so again, it's warm at the top, a little bit cold at the toes. Alright, I'm going to assess your capillary refill. Alright, I'm going to feel your dorsal pulses real quick.
And I'm going to start off listening in the
Alright, now I'm going to touch a part of your body and you tell me which one I'm touching, okay?
Left thigh, right lower leg, left lower leg, left big toe.
Perfect. Alright, so now what I'm going to get you to do is I want you to press on my arm like it's a gas pedal as hard as you can. Alright, and then I'm going to push against you and you resist me. Alright, awesome. Now you can sit up for me. Alright, so that concludes your head to toe assessment. Now, do you have any more concerns before you leave?
No.
Alright, well, we'll get you getting out of here. Everything was normal. There's no abnormalities that cause any concern. Okay. So you should be able to come back whenever your next follow-up is. And that's the end. The end.